I'm here today with Lieutenant Colonel Russell, Chief Department of Psychology at Darnall Hospital, to talk about biofeedback. Sir, what is biofeedback?
Biofeedback is a way of displaying to an individual things that otherwise would not be in their view. Things about their physiology, about their body temperature, about their blood pressure, about their heart rate, about the temperature of their periphery. By graphically displaying a screen what those variables are, we can learn to control them. With biofeedback, you can learn to raise or lower your blood pressure. You can learn to stop headaches before they occur. You can reduce your anxiety. You can actually cure a lot of things that we used to think would require medication to do, and you can do it with your mind.
So when would one use biofeedback, sir?
Biofeedback is great for migraine headaches. It can cure 75–80% of migraine can be controlled with biofeedback and relaxation therapy. It's great for hypertension. Biofeedback can be used to lower blood pressure sufficiently that many people no longer require antihypertensive medications. It is great for anxiety disorders, particularly people who are troubled with panic attacks, and therefore is about equally effective to things like Valium in treating anxiety. A lot of sleep problems too are really secondary to anxiety and a person just being too tense. Almost anything that is a result of the body's fight or flight reaction being activated, we can treat with biofeedback.
Will you please explain how it actually works?
We tend to think that mind is somehow separate from the body, but they really are just one system. And what you think is how you feel. For adults, we'll teach you some relaxation techniques and show you that when you think a relaxing thought, it changes your physiology. And that tends to be a very powerful thing that you really do have control.
And how can biofeedback services be obtained?
Biofeedback services can be obtained from the Department of Psychology. And probably the easiest way for the average person to get plugged into the system would just be go to your PCM, your primary care manager, and discuss the problem that you think biofeedback might help for. They'll put in an electronic consult to psychology and we'll contact you and set up an appointment. If you want to contact the Department of Psychology directly, we're located in the Thomas More Clinic, and you can call us at 285-6347 and request a biofeedback appointment.
Thank you, Colonel Russell. For Population Health Beat, I'm Sherry Steiner, and we'll see you next time.